So I think the first thing is the fact that you all are here. That's good. That's the first step. This shows that shows your interest, shows your commitment. And I thought, what a good day to have this sort of thing, because honestly, our field, medical field and orthopedics, is a field of mentorship. You need a guru, you need a mentor, you need a role model, and you need more than one. I mean, not just one, but maybe one big one and then others. And that's what makes you grow. And that mentorship, and I believe in a slow mentorship and apprenticeship. I don't believe in a quick this thing. So today is the best day to really have this course. I compliment these guys if they've done it on purpose. So this is my talk. It's fellowship training in orthopedics. And you can see the very first thing about doing fellowships. So I can put up this slide and all of you will be reading it. RNOH, which is Royal National Orthopaedic, Great Ormond Street, Walton Center, Neurosurgical Center, Carlsbad, Leatherman Center, all of that. So that would be the first thing. The question is that my identity? Is that what I think of myself? I would put this as my first slide. Okay? Because what I learned, 90% is from one man at one hospital. It is during the early training phase. Does that mean that that fellowship was wasted? Was that wasted? No. But where did I get my base from? I got my base here at KEM with Dr. Lahiri. So now let's just do, because it's just an inaugural talk and there's going to be details later. So basically, what is a fellowship? I mean, let's just start there. Basically, it's a variable duration training program in a specialty, and we can classify them as either a short term, which is 6 to 12 weeks, or longer terms, which could be from 1 year even up to 3 years. And there are also observerships, which I'm not going to put into this because that's a different genre actually. What we want to do or what you want to do is fellowships. And both of these have their pros and cons. Of course, the first step is, why do a specialty at all? You've done MS or DNB in orthopedics, you can start practicing, raking in the money. There is never any shortage of work in orthopedics. But why do a specialty? And the specialty is because you want to be James Bond. The specialty is not because you want to be any arbitrary guy anywhere else. And the problem is that there are many James Bonds, right? There is not just one. So you need to stick out among them. How do you do that? You do that by doing a specialty. The thing is that the specialty is also based on how you see yourself, like where do you see yourself practicing, and that thing that changes with time as well. So in my era it was something different, and today 25 years down the line or 30 years down the line it's something different. During my time, almost everyone was a general orthopedic surgeon, and there were very few people who were doing specialties. Like when I decided to become a spine surgeon, there was Dr. Ingal Aldikar, who was in Thana, so that, Thana is like another country, sorry. And there was Dr. Bhojraj, who was in Bombay. So there's the only one. So I was literally the second person who claimed I'm a spine surgeon. And then of course the whole floodgates opened and everybody came. And again, arthroplasty, there was nobody had the guts to give up orthopedics and do only one thing. But that thing has changed. Today, unless you're a specialist, you have no identity. Like in Bombay and Thane, if you're not a specialist, you don't have an identity. And in fact, patients may refer to you as a GP. Like, oh, I went to my orthopedic surgeon, who's like a GP. And he told me I need a knee replacement, so now I'm going to Dr. XYZ. Ashish Phadnis in this case. So it also depends on the time, it also depends on the place. So now, if you are from, and forgive me if I'm wrong, because I may be wrong, but if you are going to practice in Amravati, then it is less likely that you can start there as only a spine surgeon, because you'll starve. But you still need a specialty because time goes forwards, it doesn't go backwards. So let us say you start now as orthopedic surgeon, special interest spine. In 10 years from now, you start getting more and more and more of spine, and then orthopedics goes less and less and less, and then you're a spine surgeon. The next generation over there, 10, 15 years down the line, the direct spine surgeon will start over there. So I think doing a specialty is very important. In addition to other things other things are self-evident. Like the knowledge is growing like crazy. Like what we learned in MS and what is now is completely different. Like if I have to give up spine surgery, I can't even become a trauma surgeon, because what we used to do and what is done now is completely different. And there is so much of knowledge out there that unless you focus on one thing, you will be left with a knowledge gap. You will not be able to keep up with what's happening. Okay, so how do you select a specialty? Firstly, be realistic. you should know your skill set. Like, don't do a specialty just because it's there. You need to know, like arthroscopy requires some sort of 3D skills and being able to do that. Spine surgery requires solid chikati, and spine surgery requires chikati. That's a Marathi word. But it requires perseverance, and you have to be able to deal with a lot of complications and problems and cribbing patients. And you, on one hand, have to be very, very fine to work under the microscope. And you have to be very, very strong because we do a lot of things with osteopath. So that's the skill. Joint replacement, etc. So all of that. So that's your skill set is also important. Don't just take a specialty. Your interest is important. You have to be interested in it. Like, you can't just take it just because it exists or you get a fellowship. Opportunity and demand is also important. Like, you need to know what is, like, which specialty is actually in demand 5-10 years from now. You know, that's important, predicting that. And of course, financial gain is there. I'm not saying it's not there, but most of the time you will make money irrespective of okay, because at the end of the day, you want to be this guy as well, right? You want that Aston Martin. You just don't want to practice and like. So let's look at orthopedic fellowships. And this, I don't need to go through this because you all know what the things are. It's a spine, arthroplasty, sports, arthroscopy, hand, foot and ankle, peds orth, and onco. These are the ones which I could think of. There may be newer ones coming up. But so these are the sort of specialties which we have. First thing, let's take a short-term versus long-term fellowships. So I think if you want to really learn, it has to be long term. Like, I don't think you can learn unless you do long term. But if you want to see something different, and you are able to absorb it, then you can do a short term fellowship. So like, if you've done, let us say you've done 3 years of MS in a good place, already learned a lot of spine, then done a fellowship here, and then you do one short term fellowship in something specific, that makes sense. You can pick up something new. And you get the little title, you get the little name, a little certificate and a photograph. But if you want to really, really learn, it's got to be long term. What about Indian versus foreign? We can have a full day's talk on this. I think, you know, I will not go into the details, but there is a difference, and I will come to it in the later slide. Indian fellowships also have huge advantages for the simple reason that now good work is being done in India. It's not like when I was there, we were doing spine with Dr. Lahiri and everyone else was doing rubbish in Bombay. So I could not have learned in India or Bombay, right? I had to go abroad to learn. But today that's not true. Today in spine, there are like 20 centers which are doing fantastic work, which is number one, equivalent to what is done abroad. I'm not saying equal, but equivalent. Number two, it's done under our circumstance. So you go abroad and you learn something with some fancy equipment and you come back here and the equipment is not there, that doesn't help. So I think an Indian fellowship has a very, very important role in, if you want to practice in India. And foreign fellowships have something as well, which I'll come to later. Hands-on versus observership, I've already told you. Observership will help you if you're already here. Right, and then from here you can just you can go see 5 surgeries and you say, oh, he did this like that, he did that. Okay, fine, adapt. But you can't do MS ortho here, do 3 observerships in spine and become a spine surgeon. Research fellowships have their own role. One of the things, if you're interested in research, there's nothing like it. Research fellowships are really easier to get. You get money, etc. And sometimes when you don't get clinical fellowships, these act as a stepping stone, both to know people and to build up your CV, because you'll get some good publications, this, that, and the other. So research fellowship, don't diss them, but it's a long game. It's not a short game. Funded versus self-funded obviously depends on, you know, your financial situation. So then there are the Indian fellowships, and Indian fellowships are also pretty good. There's the national board, which they started around 8 or 10 years ago. They decided to have specialty fellowships, and as you all of them, there is FNB in spine and various things. I think joints as well, and this. There are the MUHS fellowships, Maharashtra or some other states, Tamil Nadu, etc. they have. Then there are institutional fellowships, which a hospital has instituted, like say Ganga. I know more about spine, so I'm talking, but I'm sure it's there in other fields as well. Then there are the individual surgeon, where you go and work with one person. And finally, there are the association fellowships, like the IOA fellowships, ASSI has got a fellowship, etc. So each of them have their pros and cons. But if you ask me, I have put them in this order, because in terms of accreditation and credibility, the National Board Fellowship would be the biggest one, right? Everything else will work, and you will get training, you will get experience, you will get certificate. But accreditation is there, and the big fear is legislation. What I mean by legislation and medico-legal is that tomorrow, suppose there's FNB spine and there are like 50 FNB spine surgeons in Bombay, and you have not done that FNB fellowship, you may be pulled out and you don't know what will happen, right? So I am a teacher for FNB spine for the last 10 years. And tomorrow, if a patient of mine goes to a student of mine, they may say that I am FNB, Dr. Dalvie is not an FNB, right? So you never know what will happen. So if you get an FNB fellowship, you should take it up. Then there are the foreign fellowships. What are the foreign fellowships available? One are the organizational ones like AO Spine, SICOT, and these sort of organizations, the arthroplasty, there must be arthroplasty, etc. Then there are institutional ones again, which are like Nottingham Hospital for Special Surgery, etc. And again, personal ones. So actually the personal ones are the better ones, or the institutional ones are the better ones. The personal ones also have an institution usually. It'll not be like this. And then the foreign fellowship, the best thing you can do is have a photo with some Gora and put it in all your slides like this. Of course, this is Gordon Findlay, who devised the microdiscectomy, and he's really a mentor. Foreign fellowships are in all these countries, and I think the pros and cons are going to be mentioned, so I'm not going to go through them. But in order of what I would select, this is the order. The reason is that there are some things in selecting a fellowship which may be repeated again in my talk. One of them is whether you are part of the unit and working. Okay, that is important. Are you part of the unit and working? Because then you get to assess patients, you see old follow-ups, you actually do surgery on your own, with somebody hands-on and do. So UK would be the best for that because the UK is the NHS. So you go, if you're good, you start operating right from the beginning. I think Australia and Canada would be similar. USA, depending on if you get in through the system. And another benchmark or parameter would be if you're paid or not, because at that time you may not have that much money. Then again, this UK, Australia and Canada, they pay you handsome salaries, which goes down in Singapore, where it is still there, but the salary is little less. Korea, they will not pay you, but there is fancy work. And then there are less common places for niche things like other places in Europe, etc. Now, foreign fellowships have got secondary benefits. I mean, one of the things is obviously that you learn your spine surgery, arthroplasty, arthroscopy, but it has got some secondary. So it is not just about learning how to operate a spine, how to remove a disc, or how to do a fusion. You also learn a different method of working, the work culture. Like here, when we also imbibe work culture, wherever we work, we imbibe the ethics, we imbibe how things are done, the systems, how things are organized. So this work culture is also very important. Like if you work in a unit in the UK, how do they function? If you work in how do they function? How do they manage their patients? How, all of that. And then that will only improve you as a human being and your systems over here. You get to work with state-of-the-art equipment. In India, we do have it, but we may not have it as much as over there because they have definitely more money and quicker access. So you'll work with great stuff. You may learn the surgery of tomorrow. You may see something there which is not available here and be able to learn that and implement that. And the other thing is you taste a way of life. I think it changes you. Living for 2 years in the UK has changed me. People stay in the, states or this, and it changes you. You get a much broader perspective of the world. You get to see the world. You even get a fake accent, but that goes away after some time. You can have your kids there, because if you have your kids, they get permanent residency. If they are in the US, they get a US passport. And in Canada, the best thing is if any of you are not going to have your kids in Australia, in US, then Canada is great because Canada gives you free university education. So you should ask me because I am paying right now for my daughter's education and it's like a lot of money. So Canada is free, okay? And also you have the possibility of settling. Like in case it is in your mind that you want to settle abroad, then this may be one foot. I'm not telling you should settle, but if that thought is there, then that gives you the thing. So the secondary benefits are also very important. The other thing is contacts and connections. So people who are doing fellowships abroad at that particular time, they are with you, they are like your friends. But later on, they are going to grow up and become somebody. So all these guys, like he said, Mark Davis. So Mark Davis was the registrar with me. He was my buddy. We used to drink beer together. But now Mark Davis is unapproachable. He's a god of foot and ankle. But I can just phone him and say that, listen, my friend is coming, can you help him? And he will help. So these connections you can build up at that stage with international. Like here we build up here. So like I said, it's a way of life. You enjoy your life, you drive around. Because there the work is not like India. Weekends are free. You get to see the UK, you get to see Europe and all of that. And a lot of other things. And please excuse me, I didn't know there would be ladies in an orthopedic thing. But as I mean, being James Bond has got some other advantages. So you can sow your wild oats. This is unofficial. This slide is cancelled. Please don't put it. Okay. And the ladies are excused from this. Anyway, so then now the question comes, there are so many fellowships. How do you select a fellowship? Firstly, name and reputation. It's very, very important to know the name and reputation. The work should be good over there. Like the work has to be good. Otherwise, there is no point in just going and spending 1 or 2 years. Whether it's accredited or not, like I told you, it makes great sense to have a named accredited fellowship in your CV. Hands-on is very important, as opposed to like just going and observing. If you get to be part of the unit and work, there's nothing like it. Funding may or may not be important, but I think by the time you go for fellowships, you're 28, 30, you might be just getting married, newly married, whatever. So the money helps, and being abroad is very expensive also. So if you get paid in pounds, get paid in dollars or euro, this thing, of course, getting it is also important. I'm just saying, it's not that there are 1,000 fellowships. There may be 1,000 fellowships, but there are 10,000 applicants. So I think that would be the order in which you go. Like, you need to aim at a fellowship which you will get. Now, how do you apply? Firstly, CV building, on which there is a talk. You need to first have local fellowships. So in your CV, if you've already done local fellowships, it gives you a standing. Your training also is very important, where you have trained and all. That all comes in the CV building. Research is important. For some strange reason, like I personally am a non-believer in research. I don't get impressed if somebody shows me 20 publications, because I say this guy has not worked only if he's done 20 publications, right? But unfortunately in the world, it's not like that. In the world, your CV is represented by your research. Like I am on the fellowship committee for AO Spine. I designed the whole fellowship plan for AO Spine Asia Pacific. I designed it for ASSI. And in our scoring system, for the lack of anything else, we have to put publications 5 marks, presentation 3 marks. We can't help it. We have to put something, right? So that but you need to have that. You can't just sit on your butt. If you're working with me, you need to do it and just come out 3. So I'll tell you, among all my fellows, I have a lot of fellows. The one with the most publication is Siddharth. And that's why he is where he is. He had the most, and believe me, he worked and published. He didn't publish and not work. So he has the most publications. If you see mine also, because they have to put my name compulsory. There are 1 publication, 1. When Siddharth suddenly took 10 publications, and then back 1. So you should learn from this guy how to do it. You need to do a web search, you need to speak to your friends, and personal knowledge is also important. Personal knowledge is very, very important. And I'm come to the personal knowledge in the next slide. Again, it's based on Siddharth. So one is, of course, your CV has to be strong and your application has to be good. There is no doubt about it. This personal reference is very important. So this is what I told you, that if you are, because a lot of fellowships internationally are like old boys club. And they want recommendation, because see, they want to train, but that is not the main thing. They need a good person in the unit. They can't have an idiot coming. So personal, like if you know somebody, if somebody knows somebody, is the best way of getting a fellowship. And abroad, the fellowships are like that. There they don't sit and score. The fellowship will be based on a personal recommendation. And in that personal reference, I just want to talk about again Siddharth and the whole of things. So the first time, like one of my fellows went to Nottingham, I spoke to somebody and that person got into Nottingham. Now, because that guy was so good, any subsequent application from my unit is considered, favorably. So, I think may have started with Manish Kothari or even before that. And then there was Agnivesh, and then there was Nigel, and all of them went through fellow, associate consultant and out. So, which includes him. So, a fellow associate consultant, and they liked him so much they wanted to keep him, but he decided to come back. So, now the next time when somebody applies, they don't even need my letter, because they worked in the same place where Manish, Agnivesh, Siddharth, Nigel. So they know that this is a good crop. So that is also very, very important. The other thing, of course, is aim right. Like, I mean, if your CV is here, and don't aim for HSS. You go to, there's Singapore, there's Korea, because you would have limited time. You can't wait forever. Like, you're 28, 30, you need to finish your fellowships and get on with life. Of course, luck is very important. Right time, right place. I know I'm running over time, but this first thing was that we can. And I'll tell you this, that I had applied for a fellowship in Liverpool, and that guy told me 4 years waiting period. So I said, okay, I'll be a lecturer. Kya problem hai? Then suddenly I get a call, and he says that, okay, the fellow for Jan has dropped out. Can you join? I said, okay, I'll join. I said, no problem. My life has sort of gone in that way because of that thing. And I went, I did my fellowship 2 years. From one fellowship, you can easily get the next one. So the first one is the important one. And unless you're an idiot, you'll get the next one. Many years later, I was at some conference in Patna. And I was sharing the room with Shankar Acharya. I'd never really met him in those days. He was there. He was sleeping. At night before sleeping, we were talking, kya, kidhar tha US? मैंने Birmingham में fellowship किया. अभी कभी क्या Birmingham में fellowship 98 में. Oh, okay. Then he said, you know what? I had got Liverpool and Birmingham. But then what happened is in Liverpool, I told him a lie. Because in UK, you can't say yes and not go. It's the biggest crime. You'll be blacklisted. And he said, मैंने उसको बोला मेरा passport का problem होगा मैं India चला गया. I said, bloody hell, that's how I got that fellowship. So it was just sheer luck. Sheer luck, right time, right place. You know, you are at a conference, you present a talk, somebody sort of introduces you, okay, this is Siddharth, my fellow working with me, and that guy has a vacancy. And I say, okay, listen, I've got a house here. Oh, he's a good guy, he's a right guy. And you get that. So luck is also important. How do you make the most of a fellowship? So that's important. It's not just getting it, but you must get what you get out of it. At the end of it, of course, you will get your certificate and you get your photographs and you will get this, but you need to make the most. I think the very important thing is to be at a level where you can learn. I think a lot of people, what I'm seeing is go into specialty too early. And I don't like it, and I don't know what to do about it. I don't like the fact that people do MS and DNB where they learn nothing and then give the FNB entrance exam, and because it's MCQ, come first, then come here and they know anda. There is no point. When I went for my fellowship, I had done 2.5 years of lecturer post with Dr. Lahiri, where I spent 2 years holding the suction to all the surgeries. I had read anything and everything, I was up to date. So I went at a particular level from where they were happy to have me. Both surgically, I understood everything and I became part of the unit in a big way. So unless you're at the level, you are not going to get a fellowship. Don't think you're going to be a go to a fellowship and learn and come back. It doesn't happen. You have to prepare both mentally and physically. So when you're going, you need to know, read the subject, know about the unit, and important is also speak to the people. Like if Siddharth has been there to Nottingham, speak to them. How does the unit work? What do they like? What don't they like? Who are the various bosses over there? Okay, Median likes this, someone else like that. So you need to prepare. You just don't land up, just pack your bag and go. Mid-path. Mid-path means what? Be in the middle. Like, don't be and don't try to over-impress from day one. Don't go and say, stand up and say, I would do this and all. No, just keep quiet. Answer when spoken to. They should like you. I know one thing about abroad, like whites at least. Once they like you, they have to like you. Once they like you, they will just promote you like anything, right? They will promote you like anything. So they just have to like you. That's very important. One important thing about, if any of you want to stay in the fellowship longer or do more fellowships, there is only one song you have to sing. The song which you have to sing is that, I want to go back to India. When you sing that song, they will give next fellowship, next associate consultant. If the song you sing is, I want to stay in the UK, you will get a big kick within 6 months. So that's one song which you have to sing. I want to go back to India. People need me. There are so many scoliotics walking around. My God, all are bent. I'm going to go and make them straight. So anyway, the other thing is read. You should read. I tell my fellows, there is, use all the time. You've got 2 years or 1 year fellowship. Make bloody use of it. You don't need to watch Netflix at that time, right? You can watch Netflix later on. Your spare time, make use of it, read, study, be there and work hard. I mean, this is like a given, but it is appreciated. The working hard is appreciated and they will this thing you, but also have fun. Remember, these days don't come back. Like I said, these are the days of 28 to 32. If you have kids, your kids are small. If you are married, your spouse is young. This is also the time to have fun. And luckily, as compared to India, abroad is a little better. They have a little work-life balance. Not huge, but a little. So most of the time your working day ends at 5 or 6 and the weekends are free, 3-4 weekends of maybe free in a month. You travel, use that time to see and build memories which you love. Even I still have memories. What time, kya. So have fun. Don't just think. Finally, to come to the conclusion, is a fellowship mandatory? Like, do you have to have a fellowship to practice? It's a little plus minus, but yes, you get skills there which you don't get. We already spoke about it. You develop your personality, like you develop your personality, and all said and done, there is a polish which comes, there is a sheen which comes. You build your profile, like you do build your profile. It's like, okay, he's Nottingham trained, he's this, he's that, and all of that. It helps you to get so-called attachment, because when you apply to a like a Jupiter hospital or something, it will make, like if somebody applies and he's done KEM lecturer 5 years, associate professor 2 years, I know that he's better than somebody who's done this thing and 1 year observership in Singapore. I know that. But the hospital people, the guys who are not doctors and who are appointing, they may think that, this foreign guy is better. And does it make a difference in practice? The answer is a big fat no. Your practice is based on completely different skills. You may not even know how to put a pedicle screw, and your practice will be better than mine. Practice is a different skill. I think that will require a full 1 week training program of how to build up practice. So with this I end, and you all come here to learn, and I wish you all the best for your future and your careers. You all are bright young orthopedic surgeons. So just be positive and all the best.